welcome. You're watching We the People. I'm Sonal Mehrotra Kapoor. Now, as 2020 draws to a close, we have looked at various fallouts of the pandemic. The biggest has to be unemployment. But did you know that lockdown unemployment drew more women out of the workplace than men? We can actually show that with some very simple data and graphics that we'll take you through. Now, let's look at this one. In November, about 8 months after the lockdown, there were about 13.5 million fewer people in the labour force compared to the November of 2019. Now, that's about 6.8 million men and about 6.7 million women. Doesn't sound like a big disparity there, right? But well, look at it and remember in the context of already women being much lesser in the workforce compared to men. So in percentage terms, the labour force entire force actually shrunk down to about 13% for women, but just about 2% for men. While this is a shocking number, to get a complete holistic understanding of how the story of women in workplace has unfolded, let's rewind a few years back. And for that, I have a graphic for you that will help you understand where we stand. Where does the story of women in workplace actually stands? Well, the graphic on top of your screen right now at the moment talks about participation of women in the workforce from 1990 to 2020. You see the line steadily go up, and then there is a dread-top sort of decline over there. That means, and what does it tell you, is that the pandemic's cost to women's employment has only worsened an already precarious situation. Now, India has one of the world's lowest female labour force participation rates according to the International Labour Organization. Even if you were to pick up a basic index like a global gender gap, that will tell you that India fell from the 98th rank, already quite a poor rank, in 2006 to 112th in 2020. If you look at it in terms of the economic participation and opportunities available for women, well, the figure is even more shocking. India fell from 110th in that rank to 149th. That's the fourth spot from the bottom of that list. When it comes to the gender gap index, there we are worse than Saudi Arabia. So the problem clearly is long-term, and the pandemic has only made it worse. What are the reasons behind this? What sort of policy changes are required? That will be our focus on We the People today. I'm Sonal Mehrotra Kapoor. Let me introduce you with the panel now. We have Mithali Nikor. She is an economist and founder for Nikor Associates. She's been looking in depth into a lot of analysis and number crunching on where does this entire disparity between men and women stand. We have Rituparna Chakrabarti. She's the co-founder and executive and vice president for Team Lease. She will be bringing us a corporate perspective on all of this. We also have Madhura Das Gupta, founder and CEO of Aspire for her. Now, Madhura is somebody who's been watching out for trends and helping women stay in the workforce. And we also have Nishtha Satyam. She's the deputy country representative for UN Women in India. Good to have you. And then we also have Nikhil Dey, co-convener of NCPRI and social activist. He's a noted voice, a lot of us know, has been working with women in the rural sector, and will get us the male perspective on the panel as well. Welcome to you, Nikhil. Thanks so much for your time. Let me begin by giving Mithali the first word, somebody who's actually done a lot of research into this. Mithali, the basic sort of numbers that I spoke about in the introduction tell us a very grim picture of where women in the workforce stand. Take me through some of the other couple of highlights over here, and mostly the reasons why this disparity is taking place. Why is it that in the pandemic, when it came to unemployment, women stand to lose much more than men?
Thanks a lot, Sonal, for having me on the show, and very good evening to my fellow panelists. So, just straight up, we have been looking at the data from 1955 to 2018-19 when we're looking at the NSSO figures, which are released by the Government of India, and more recently looking at CMI data to sort of understand, what is happening to women in the workplace and women in the labor force. Now, over the years, there has been a secular decline in how women have participated in the labor force and in the workforce. Women are moving out of the workforce in large numbers, rather large proportions, primarily from rural areas. But now, when we look at the situation with the pandemic, it has really impacted women very, very disproportionately. I'll just give you a few statistics. When we look at the immediate impact, the month after the lockdown was announced, 15 million women lost their jobs. That is about 37% of working women versus 28% of men who lost their jobs in that 1 month. Now, 8 months down the line, we are sitting in November 2020. When we compare to November 2019, overall the slice of the labor force has shrunk by about 3% compared to last year. But the impact on women has been disproportionate. Women's labor force has actually shrunk by 13%.
Why is that?
And what does this show us? This shows us that women are clearly being discouraged from even looking for work. They are moving out of the workplace altogether. And we are seeing this impact much, much more in urban women, where we see that the urban female labor force has actually contracted by 27%. Versus 3% for urban men.
Okay.
So, what is really going on? Some of the reasons that I can highlight upfront, and of course, more will come as we speak. The first is that rural women definitely not as badly affected by the pandemic because agriculture as a sector is still growing. The second is that rural women also have access to a number of other government schemes, like you have the Narega scheme, and you also have mask and PPE manufacturing, which is being done by a lot of self-help groups in rural areas, not really reaching the urban areas. In urban areas, there has been a disproportionate impact on certain industries which employ more and more women. For example, retail, hospitality, beauty industry, which involve very high-touch services. Also, you have a situation where there is an increase in the burden of unpaid care work on women, especially in urban areas, because you have school closures and you have the disproportionate impact of COVID also in urban areas. But most importantly, there is a historical reason for all of this, which we've been seeing across the decades.
Hold that thought there, Mithali. We'll talk about the historical reasons and the long-term reasons on why we are seeing this in just a bit. First up, I would just want to concentrate on what happened in the pandemic. Let me bring in Rituparna Chakrabarti over here as well. Rituparna, you heard Mithali there talking about a very clear divide between urban women and rural women when it came to the pandemic. What has been your reading so far?
I think most of what Mithali covered is bang on. However, I'd just like to add a few points. What essentially happened is that women who are coming into the towns and cities or urban areas to work, we have to look at them at different levels. Some of them are involved in unskilled work, some of them are involved in semi-skilled work, and of course skilled work. So those in unskilled and semi-skilled, the nature of their work have largely been outbound in nature, who got severely affected because of the lockdown. So a lot of these people had to, that's why, wind up and either go back or just, leave their jobs and sit in their homes. In skilled work, what essentially happened was if both husband and wife are working, we know the realities and challenges which happen because at homes we did not have childcare, domestic servants were not coming, nobody from outside, and essentially the burden of looking after the household fell on the women, which actually also prompted a lot of women to opt out of the workforce during the pandemic. While of course there are opportunities which has emerged for women during the pandemic, during the skilled period, but the reality is in the short run, it has taken a toll on women. And when there was a choice to be made within a household, between the man and the woman in terms of who continues, given the challenges of managing the household, I think it was the women, like has been always the case, who we saw have been relenting.
Okay. I have Nishtha Satyam also joining us. Nishtha, the irony and perhaps the paradox in all of this is that if you look at the statistics, over the past couple of years, we've had more women in classrooms. We have more MBAs in women. We have more PhDs being given to women. But somehow it's not translating into women in the workforce. Why is that happening?
Sonali, I think there are many reasons to why that is happening, but I think there is authoritative research yet going on that subject. But the one thing that we know for sure is that the more we see women in classrooms and the fewer the opportunities, women are less likely to pick up low-value jobs. So essentially, the point that I'm making here is one of the strong reasons for workforce participation and a decline in it is because women are not choosing to do low value added jobs after having spent a certain time in the classroom. That said, I think, we're at a point where I think there needs to be a fundamental redefinition of the world of work. What work constitutes? What do we recognize as work? Because I think we've gone through a radical shift in those definitions as of today. What we know is that women have had a poorer starting point as compared to men. And whether it be the pandemic or any disaster, women tend to be more pressurized, pushed out of the system because they're already at the margins. We also know that the sectors hardest hit by COVID employ the largest number of women. 40% of all employed women globally actually work in sectors like service, retail, entertainment, export and labor intensive manufacturing, which employ a high amount of women. And we also know that there has been a surge in unpaid care work, which has pressurized women, their schedules, their time, both rural and urban. And we also know that women have lesser access to what we call productive resources, which is access to land, labor, financial capital, which always makes it harder for them to weather a crisis, bounce back, and rebuild their lives. An analysis of Ebola would tell you that women took twice as much time to come back to where they were, and only 50% of women actually bounce back to where they were before a pandemic. So I think we have some serious data in front of us that we all need to look at. But more than data, we also have very, very strong narratives of women migrants. Let us also remind ourselves that they are the largest community of migrants in the country. And I think serious attention needs to be paid.
Right. I think talking about migrants, that's something I'll come to in just a bit. Let me bring in Madhura as well. Madhura is is the founder and CEO of Aspire for India, and she's been looking at women and trying to bring them back to the workforce and sustain them, keep them here, not let them leave that bracket as well. Madhura, we were discussing earlier on, one of the hardest hit sectors have been those of sort of women who were entrepreneurs, who were women who were starting out. Take us through some of that. What has been the study that you've done? You were saying a lot of women entrepreneurs lost out, especially in the service sector in urban India. Take us through some examples on that. Madhura, I think you're on mute. If you can unmute yourself, please.
Thank you so much for the question, Sonal. Thank you for having me here. We're a young startup, Aspire for Her, and we have the mission to include 1 million women in the workforce by 2025. We want to motivate young girls, 18 to 25, to enter and stay in the workforce. And in the context of the pandemic, we were actually seeing a lot of data coming out globally. So we saw the HBR study, we saw the Stanford study, and we realized that self-employed women were actually the hardest hit in the pandemic. And why is that? So we sat down and did our own research, and we spoke to more than 700 women in our community to try and figure out what was exactly going wrong for them. And what we realized was that women who were self-employed were actually finding themselves bearing the brunt of the pandemic much more than the men.
Why?
The reason being that they did not have resources. Like in the corporate world, you actually had backup teams and resources. So productive resources were far less available to them. Even when it came to the simple concept of getting the bandwidth at home, it was the husband's organization which took precedence. It was the child's classes which had greater priority than what she would be able to actually access. The other bit was the general nature of entrepreneurship itself. It's a 24/7 job. So the minute, and we saw some data around ILO, where women were actually spending 5 hours in unpaid housework as opposed to men who were just spending 29 minutes. So as a natural corollary of that, the number of hours that women had to devote to their business goals naturally reduced. It also meant less face-to-face meetings, as a result of which business deals were not being struck. So yes, we found that a lot of women pivoted very innovatively to come out of this space, but women in the entrepreneurship space, especially startups, suffered the most during the pandemic. That's what we found in our research.
But is it just the factors at home and just the kind of work that women are not being accounted for? Is it just that, or is there more to this? Let me take that forward. Nikhil Day, your opening comments on what you're seeing right now. This disparity has remained for quite some time. The pandemic has hit us so hard that now a lot of people thinking, how exactly are we going to come out of this?
Yeah, so Sonal, I'd like to actually look at this particularly from the point of view of poor women, marginalized people. The pandemic obviously hit the most marginalized the most, and amongst them, the women would obviously be ones who have always suffered even more. This is something that's very clear from this study and startling set of pictures that you showed and the other panelists have been talking about. But I'd like to look at it from a perspective of, let's say, MGNREGA, which was mentioned earlier. MGNREGA is a program that was a fallback program. It brought women into the workforce in large numbers, unpaid women in household work and agricultural work. Both for the first time entered the workforce, although obviously only for 100 days. MGNREGA this year, we have known how much it has taken off, even though it was derided, how much of a support it has provided. And the figures also show that the percentage of women in the workforce in NREGA went down. Why was that? Because men were also returning from their migration from everywhere else and they were entering the MGNREGA workforce. But the numbers, the absolute numbers went up.
Why were men given precedence over here?
So men were not given precedence. MGNREGA is a demand-based program. So both many more men and many more women were demanding work. And in absolute numbers, the number of women in MGNREGA went up dramatically. And I want to just point out these figures. All India, the figures was 4 crores in 1920 of women. And it went up to almost 5 crores, 50 million in 2021. In Rajasthan, the figures were that women were 61% of the workforce in 1920, came down to 59%, roughly 2% down. But in absolute numbers, they went up from 49 lakhs to 58 lakhs in the workforce. So what I'm saying is NREGA saved all kinds of marginalized people, including women. And it shows you the way ahead. And people all over have been asking for 200 days of work. You need actually a much greater NREGA to at least support those women who are being thrown out of the workforce. And you need an urban employment guarantee with a focus on women. Economists like Jean Reyes have been talking about DUET, a decentralized urban employment and training, with particular focus on women, because as your study shows, women have lost a lot. And the last point I'd like to make is that particularly marginalized women, sex workers, no work at all. Women as many domestic workers had a huge loss and a huge take, a huge amount of problems. People who are HIV positive and who are women, transgender, the street vendors who are women, all have had great amounts of problems, and therefore you really need special help for people at that level. What you're seeing in this study, if you look at the economic impact on the very poor. What kind of special help are you
talking about, Nikhil?
Sorry?
What kind of special help are you talking about here? What's required?
I'm saying, like, we've almost had a depression, we have had a recession. And in a time of a recession and a depression, actually the US, when it had its Great Depression, had a new deal. It gave an employment guarantee in public works, in all kinds of other works where people could get work, as many people who wanted to work at minimum wages. That's the kind of program that is needed in this country. Yes, all the other efforts are needed, but the ones that are working, that's why I talked about NREGA so much.
Right.
It's one that has worked. It's worked for all the marginalized, and it's worked for women as well, and it's worked for the rural economy's revival as well. It's a very, very strong case with statistics of what should be done.
Nishtha, I want to come back to the paradox over here. I spoke about how there are more women in the classrooms, but still it's not translating to more women in the workplace. We talk about how more women, substantially more women, and I'll have that graphic up on the screen as well, migrate as well. But again, we're not seeing them translated into workforce as well. Just break it down for our viewers why this is happening, and is there an easy solution? I know there are no quick fixes here, but what is the sort of problem that we need to identify and then work on now?
Let me start with the bad news, that there isn't an easy solution, and I think there will never be an easy solution to achieve equality. I think it's a very, very hard-fought road. We know that from our history. We know that from the history of our peers, of our other countries. The one thing that we absolutely must make a point of focus is we are not going to achieve equality or parity in the workforce accidentally. We are only going to achieve it if we are going to be intentional about that change, which means that we articulate that intention both in legislation, in programs, in policies and schemes, and also expand some of the things that have worked in this country. But for that, we need to understand where the problem is. And I think one of the things that I definitely want to table today is to re-understand the world of work. Today, when we look at the world of work, we're only looking at formal sector workers. What we measure is what we know. What we're not looking at, and thereby end up completely invisibilizing, is informal sector workers. Let's remind ourselves that about 93 to 97% of India are informal sector workers, and a large part of them are women. But these are not primary contract holders. For example, let's look at construction. Now, any layman, laywoman who would go around the city sees a large number of women on a construction site. But you'd be very surprised if you were to do an actual audit of the number of women who held that contract. So what happens is women are not primary contract holders and therefore completely fall within the cracks. And that's
yet,
true for also the gig economy that
and yet at the height of the pandemic, the actual warriors were women on the ground. You had Anganwadi women going out and working. You had, these were the women who were holding the fort and risking their lives and also helping us all out. If I can put out those numbers for our viewers as well, at least 1 million accredited social health activists were on the field during the pandemic. About 1.2 million Anganwadi workers, about 2 lakh nurses and midwives took additional responsibility at larger risk during these times. If this is not one story that we really have to keep track of, I don't know what else is. Sadly, that's all the time we have on the program at the moment. Thank you all for joining us with your perspective. This is a good note to end 2020 on, I guess, to remind ourselves of this disparity and also, in a way, help in meeting that gap. That's all from me. Thank you so much. This was We the People this week. We'll see you again next Sunday. Bye-bye.